Well, greetings. This is Seth Craig, Field Coordinator of Clinical Care for PEMS. I have the privilege, distinct honor, whatever you want to call it, to come straight to you from my office studio and give you a rundown of the 2023 protocol updates regarding both policies and procedures. So there's a lot of great things going on. We're going to run through some announcements and then look at some of the either the updates or additions to our protocols. We had some both in administrative policies, the AEMT scope of practice, adult protocols, pediatrics, some procedural updates, and then some information about supporting documents in the app. All right, so first announcement. Please know that there is a protocol review request form on our website. This is used by EMS providers, physicians, ED staff. As you're looking at protocols, if you find what you might think is a discrepancy or something like that, you might want to see an improvement or a change in the scope of practice. Maybe you've come across some literature and it has, covers a new treatment or intervention. Please use this form to notify PEMS. This will go to the PPP committee, the Policies, Procedures, and Protocols Committee, which we review all of these. And we'll look at that as a recommended change, update, correction, whatever it might be. But this has actually gained a lot of popularity, so we really appreciate those that have taken the time to submit the request. We do review all of them, and I apologize if I don't get back to you about them all, but we really do appreciate it, and they are really, really important to improve the care here in the PEMS region. PEMS medication box exchange. Please use all the forms in that box. This is nothing new, but just a friendly reminder. It really helps to ensure our compliance as far as the region goes with our regulations. We are very unique here as far as an EMS system across the nation, really. So we want to keep this program going. So make sure that you are using those forms, fill them out completely, legibly, and accurately. And please help us catch excellence in action. As you know, we have our annual regional EMS awards. There are several different categories. Congratulations to all of our nominations from last year and all of our winners. So we had several that actually took the governor's award. If you don't know, all of our regional award nominees go to the state or the governor's award in November. So really, really important to give us all the information that you can, contact information so we can get back to you. The deadline for this is April 21st so that we can do our nominations and our own regional awards. And speaking of regional awards, we are back again at Busch Gardens. May 20th is the date you want to save in your calendars. It's a Saturday. I believe we're still doing the discounted tickets and that kind of thing. So please mark your calendars as more information is available for that whole banquet. It'll be made available to you. So watch our website, watch our Facebook page, and help spread the word. But again, May 28th is that date you want to save. All right. So in addition, the AEMT scope of practice update. This has been in the works for quite a while, and excited to say that it actually has happened. Go into effect March 1st of 2023. The PEMS Medical Advisory Committee, the MAC, has voted to bring the AEMT scope of practice to the state level. This, of course, is with your medical director or emergency physician approval and under medical control. So for this year, any interventions, we'll talk about, well, not any interventions, but the new interventions that have been added to the PEMS scope of practice is requiring med control. Several OMDs just expressed some concerns about this being new, especially when we're looking at different medications that we're not used to administering in the PEMS region. So be careful, be aware, make sure you use med controls. So hopefully in 2024 we can remove these brackets. I believe this is going to have a very significant positive impact in the pre-hospital patient care in many areas or parts of the PEMS region. So I'm really excited about that. But again, with new skills, comes a lot of responsibility. So let's talk about the first one here with cardiac arrest. So with this, the only change here for the adult cardiac arrest is now the AEMT can administer epinephrine in cardiac arrest. Um, just note that this is different. This is not the 1 to 1,000. This is the 1 to 10,000 dose. Um, so again, this is actually red dotted. So this is from the Office of EMS. It must have proof of prior training by the provider's medical director. And also it is under med control for this year. So red dot and med control. Another change, we had a environmental heat exposure and then an exhaustion and heat stroke / hypothermia protocols, which are exactly the same except for the title. They've all been combined now into heat exposure. So the protocol hasn't changed, just these two are now one with the same procedures. So check that one out. Also under adult protocols, the exception protocol has been removed. This has always been, for quite a while, really a confusing protocol. According to the Virginia Office of EMS, the scope of practice and the formulary are the ceiling for an EMS provider and never to be exceeded. So whatever is in the state scope of practice, that's the ceiling. Of course, there can go below that, but not above that. So in other words, no field amputations, things like that. So whatever is not in the state scope of practice cannot be done in the pre-hospital setting. So that exception protocol is removed for 2023. General pain management. So this, the only change here is now that it is part of the AEMT scope of practice under med control. Everything else stays the same. It just looks a little different now because all of it has been grouped together. However, there's a general reminder here. This isn't the protocol. It's a reminder to everyone, right? So pay attention to your patient. So for those that might be frail, low weight, maybe opioid naive, elderly, reduce your dosage. There are emergency physicians that are concerned or have indicated that there have been patients that have been basically snowed by EMS providers. So as a reminder, consider your patient and use those lower dosages as necessary. For allergic reactions, this is both the AMT, EMT, or paramedic and intermediate. We have just added Atrovent to this protocol. So that's that. So in addition to albuterol, you can also administer Atrovent to adult protocol allergic reaction as necessary. For the respiratory distress, asthma, COPD, croup airway, the AEMT can now nebulize epi. This is a red dot. So again, it means that the provider's medical director has to have, or there has to be documentation that the provider's medical director has approved them for this procedure. In addition, it is also bracketed for the A, which means you must call med control prior to administering this. For medical seizure, another change for the AEMT. This is now in your scope of practice. It's bracketed, so please call med control prior to dosing or administering. And for everyone, again, another reminder, similar to the opioids, consider your patient. Frail, hypotensive, underweight, use half a dose. Again, this is for actively seizing patients, is when we're going to administer the Versed. consider your patient, administer half a dose if they fit those criteria or if that's what you think is most appropriate for your patient. With sepsis, the only change here is it looks a little different as far as the format goes. Currently, we have a little chart. As of March 1st, the criteria will look like this. So suspected infection with a measured temperature of either like over 100.4 degrees Fahrenheit or below 96.8. And then at least two of those criteria, such as ultramental status, high risk, maybe a hypotensive, either by MAP or by systolic blood pressure, increased respiratory rate, or an end tidal less than 25. So that's how that criteria is going to look pretty soon. Let's move into the pediatric protocols. So we actually have a new behavioral emergencies protocol for the pediatric population. It'll look similar to the adult protocol. Obviously, just the dosages will be different. This is for only intermediate and paramedic as far as these medications go. We also have a new crush protocol for pediatrics. Again, similar to the adult, however, the dosage will be a little different. Anytime, it's always okay to contact med control for advice or guidance. There's also a new pediatric sepsis protocol. So this is the chart. This is how it looks like as far as the criteria go. And then here's what the actual protocol looks like. They do ask that you give a pre-hospital sepsis alert if your patient meets this criteria. There is a new pediatric hypotension and shock protocol. Here are the signs or symptoms that you're considering, such as ultramental status, poor perfusion, chest pain, syncope, shortness of breath, maybe pulmonary edema. Those are all signs of inadequate perfusion, so consider this protocol. For the AMT, there is fluid bolus, for A, I, and P. For I, you're monitoring the cardiac rhythm, and then you may also consider epinephrine. Pumps are preferred. Obviously, we don't all have them available, but if you go that route, please monitor the IV site very closely. Across the protocols, as far as the pediatric allergic reaction, SVT, trauma, and the VVIP pulses VTAC, they just standardized the fluid bolus to make it uniform and just easy. So we're still using sodium chloride. You're looking at 20 milliliters per kilogram, either IV or IO. And it's a bolus, and you repeat as needed to maintain that adequate perfusion up to a total of 60 mils per kilogram. Like I said, it's a total. Please continue to reassess the vital signs, lung sounds, the patient's work of breathing after each bolus to ensure we're not giving too much fluid for these patients. After that 60 mil per kg dose total, if the patients continue to be hypotensive, you can contact med control for guidance. For the pediatric respiratory distress, the AEMT, again, under med control, as well as along with the red dot training, can administer epinephrine 1 to 1,000 nebulized. For seizures, the only change here is for pediatrics that is now part of the AEMT scope of practice with med control. So patient is actively seizing, contact med control prior to administering the Versed. For pain management, for pediatrics, again, this is the only change here is for the AEMT. They can now administer pain med under med control for the pediatric patient. For the pediatric asystole PEA, the AEMT can now administer epinephrine. Again, we call this the cardiac dose of the 1 to 10,000. It is a red dot, so that means there has to be proof that this provider has been trained and approved by the OMD, as well as at the time to contact med control. So here's a, I guess, a addition or procedural update. Those have been around for a little while. You know, remember we used to have these pictures in there. They were removed a little while ago by the Medical Advisory Committee, but based on some input by hospital providers using that form, it is being brought back. So as appropriate, you can acquire the right-sided ECG. The information's in the protocol, as well as that diagram has been brought back to the procedures. This is the CPAP procedure. The only real change here is now the EMT can titrate, right? So remember that CPAP, BiPAP, PEEP are all red dot for all EMS certification levels. So EMT, AEMT, intermediate, and paramedic. CPAP is a red dot. So that means that it must, the provider must have evidence of training and approval by their medical director to use those procedures. There is a new neonatal resuscitation protocol. This was, again, another deficit recognized within our protocol, so it's been added. Your medical director or designated agency representative should have the complete protocols. They are available now for training. They will not be released on the PEMS website until March 1st. But to see the entire protocol, to see all these protocols, contact either your medical director or the designated agency representative. In our protocols, we will be adding just the supporting to the supporting documents, the PEMS Regional Medication Box Plan. Just a reminder of how the exchange program works. And we'll also have the schematics in there. So when you're looking at training, it's all on our website. We're going to add it to the app so that we can look at that. Advanced distribution of the 2023 protocols. This is how we've been doing this. So any designated agency representative can request advanced distribution. We have both the full protocol package as well as the just the update packet for this. They just need to email me to request that, and I'll send that to them. And don't forget, our PEMS protocol app is available either through the App Store or through the Google Play Store. You must have internet to download it, but you do not have to have internet to use it. And on March 1st, it'll be updated. So again, thanks for checking us out. Hope you have a fantastic and safe year.